The Value of Health Education Specialists, Exploring Career Options Within the Profession. Thank you for joining us on a Friday afternoon. We're quite excited to dive into this topic with you today. So before we get started, just to go over a few housekeeping items so you know how to participate fully in today's event. You'll be muted during this webinar just due to the number of our attendees, but there will be a roundtable later on in the presentation where you can ask questions of our panelists. And you can do this by typing your question into the Q&A box at any time during the presentation, as you think of a question. If your question is specific to one panelist in particular, please make sure to include their name when you submit the question. And contact information will be provided at the end if you have any additional questions. Please note that there will be a follow-up email sent to all attendees. I think it's going to go out tomorrow, and that follow-up email will include a link to a short survey, which is required for you to fill out, should be brief, in order to receive that CHES or MCHES continuing education credit if you are certified. I'd like to take a moment here to introduce today's webinar moderators. First, Holly Turner-Moses. She is she's MCHES certified and currently works as an instructional assistant professor at the University of Florida in Gainesville. There, she is the coordinator for the Department of Health Education and Behavior internship program and the online Master of Science program. She teaches undergraduate and graduate health education courses and is a faculty advisor for the Eta Sigma Gamma Alpha Lambda chapter. Also with us today is Katie Bliss. She is MCHES certified and currently works as a professor at Austin Peay State University in Clarksville, Tennessee, where she teaches undergraduate public health classes and MPH classes, and also serves as a faculty advisor for the Eta Sigma Gamma chapter. And now I am going to turn it over to Holly to get us started today.
Wonderful. Thank you so much, Jess. Hello, fellow health education professionals, and welcome to our wonderful students who are joining us on this Friday. Happy National Health Education Week. Again, my name is Holly Moses, and I'm thrilled to serve as a co-moderator for this webinar. Today is the final day in recognition of National Health Education Week 2024, and the theme for this Friday is workforce development. We are bringing you a spectacular webinar today hosted by NCHEC. The title is The Value of Health Education Specialists, Exploring Career Options Within the Profession. The webinar today will highlight types of careers for health education specialists in various employment sectors. The sectors include healthcare, government, community agencies, university and school settings, as well as the wellness community. Joining us today are 4 CHES and MCHES panelists who will provide a day-in-the-life view of their employment duties and also provide advice for future health education specialists. Finally, we welcome your participation in our roundtable. Any questions that you have for the panelists, please share them through the roundtable Q&A session. The learning objectives for today's presentation: the participants will be able to identify a variety of settings where health education specialists are employed, describe how health education specialists engage in the areas of responsibility while practicing within different employment settings, and explain the major responsibilities and value of health education specialists in improving the health and well-being of populations. Next slide. Before I turn the presentation over to our wonderful panelists, I will ask the audience to participate in 2 polls. After all, it is election season. The first poll question asks, from the 8 areas of responsibility for health education specialists, which area are you most excited to use in your future professional role? So thinking about those 8 areas, which area are you most excited to use in your future professional roles? So let the audience take a half a minute to respond. Will they choose area 1 with assessment? Are they more excited about a leadership role with area 7? Who's really involved with research and evaluation? That would be area 4. So let's see where everyone is thinking that they're excited to utilize these areas.
They're still coming in. I'm going to close it and right about now.
Okay, let's see what the results say. Wow, so really pretty steady across the board, not like a huge winner, but it looks like implementation just edged out leadership and management and is just ahead of advocacy. So wonderful, but really a nice spread across all 8 areas. It's very exciting to see that. All right, let's move on to the second poll question. Which of the following common health education employment settings are you hoping to work within? So again, I'll give you about half a minute. Select one of these common employment settings. If the employment setting that you're considering is not one of those typical ones that we see, we know we have health education specialists beyond these common 6 sectors, please do select other. Get an idea of where everyone is thinking they're going to work after graduation.
Right, I'm going to share these results.
Okay, so it looks like nonprofits and community organization was the #1, right below that and tied healthcare, including hospitals and clinics, and university settings with academic and college health. Wonderful. So we have folks from these sectors as well as others that are in close proximity with the results. And I'm excited to now introduce our panelists and then let them take over the mic. So our first panelist is Janelle Bryan, excuse me. She's a public health practitioner and educator working at the intersections of race, health, equity, and pleasure. She is currently the Director of Community Wellness, Outreach, and Strategic Partnership at Drexel University's 11th Street Family Services. Welcome, Janelle. We're so happy to have you. Next, we will have Savino Stallone, who's the Director of Patient Education for Orthopedic Surgery at Montefiore Medical Center. He earned a Bachelor of Science in Health Education and Health Promotion from Arizona State University and has been CHES certified since October 2023. He is a published author of several orthopedic papers focused on health literacy and postoperative outcomes. He is currently earning an MBA at Strayer University's Jack Welch Management Institute. He lives in New York with his wife and 2 daughters. Welcome, Savino. Next, we have Monica Webb, who's completed a Bachelor of Science in Health Science Education with a minor in secondary education from the University of Florida, then went on to complete a Master's of Public Health from the University of North Florida. Upon returning back to the University of Florida, she completed her PhD in health behavior. Dr. Webb has over 22 years of experience in health education, serving as a middle and high school health teacher, a university faculty member, and most recently, college health educator in her role as the Director for Gatorwell Health Promotion Services at the University of Florida. Welcome, Dr. Webb. Last but not least, we have Vanessa Cummings, who currently works as a health educator for the Health and Racial Equity Units at Sacramento County Public Health. She supports the efforts of the unit by internal and external education and outreach to advance racial equity. Originally from San Diego, California, Vanessa is a first-generation college grad, attaining her MPH from Cal State Northridge. Welcome, Vanessa, and all panelists. We're so happy to have you today. And now I will pass the microphone over to our panelists who will discuss their current health education positions, and Savino will take it over first.
Hi, everyone. Thank you for taking the time out of your Friday afternoon to be here on this webinar. First off, I just want to thank the whole incredible National Commission for Health Education Credentialing team for inviting me to be here this afternoon alongside of these other great panelists and champions in the field of health education. So again, I'm Savino Stallone. I'm a certified health education specialist and the Director of Patient Education for Orthopedic Surgery at Montefiore Medical Center in the Bronx, New York. I'm deeply passionate about the value of health education specialists and the wide range of opportunities in this field. So who am I? Where do I work? What do I do? So I work at Montefiore Medical Center, and they operate 13 hospitals across New York City and nearby areas with over 300 primary and specialty care locations. Now, recently, Montefiore made headlines in the news and on Instagram and social media because they got a $1 billion endowment to ensure that no medical student ever has to pay to go to their medical school ever again. So it's huge, and I take a lot of pride in being able to work at Montefiore. At the hospital, I oversee patient education for orthopedic surgery. So this includes preparing patients for their hip, knee, and shoulder replacement surgeries. I manage and teach preoperative education classes, and I do one-on-one sessions with patients to develop and deliver content in both English and Spanish I also work closely with surgeons, nurses, and physical therapists to ensure that the patients are confident and informed about their health and surgery. So I want to make sure that they are ready and prepared for their upcoming procedures. What I love most about my job is the opportunity to empower patients through education. Helping them feel confident and informed about their health and surgery, to me, is incredibly rewarding. My responsibilities highlight one of the key sectors for health education specialists, healthcare, especially in the hospital setting. And I saw the poll that just went up. I know that potential health educators are really excited about working in a healthcare setting. So hopefully my presentation here sheds some light on what you can do in a hospital. However, our field extends far beyond hospitals, offering a wide range of career paths that contribute to better health outcomes. So what exactly does a health education specialist do? Our work is guided by the 8 areas of responsibility set forth from NCHEC, which define our scope of practice. In my role, I focus on 3 main areas: implementing health education programs, conducting evaluations and research related to health education, and I serve as a health education resource person. These responsibilities are not just technical tasks. They're the foundation that allow us to make a positive impact on public health. Whether working with individual patients or entire communities, our goal is to promote healthy behaviors, prevent illness, and improve the quality of life through evidence-based education. Health education specialists play a vital role in improving health outcomes, whether through direct patient care, like I give in my role, community outreach, research, or policy advocacy. The opportunities in this field are both diverse and impactful. If you're considering a career in this profession, I encourage you to explore the many ways that you can contribute to a better health and well-being of our community, and take pride in the profound difference that you can make as a health education specialist. Thank you.
All right, can you hear me? Awesome. Good morning, everyone. Hello. Thank you so much, as Savina said. Thank you. That was such a great presentation. Thank you for taking the time today. Thank you for NCHEC. I'm humble, like Savina said, to be amongst such amazing change makers. My name is Vanessa Cummings. I use she, her pronouns. Coming to you from Sacramento County, serving what is now known as Sacramento County, but is the unceded lands of the Maidu, Miwok, and Nisenan peoples. I work as a health educator for the Sacramento County Public Health and Racial Equity Unit, and I've been in this role for a little over a year, but my career in health education now spans a little over 8 years. And so my position currently most closely aligns with local government. And you can go ahead and go to the next slide. So as Holly mentioned, my current role, I work internally and externally to advance racial equity work across Sacramento County Public Health. Our unit is very young. We're 2 years old, and we kind of stemmed from the declaration in 2020 as racism as a public health crisis. So the last 2 years, we've been building our infrastructure, training staff, kind of level setting each other, and also working externally with communities to connect them with public health programs, leveraging relationships, and kind of moving away from that transactional behavior that health departments traditionally have to more intentional practices, right? It's definitely a work in progress, but that's what we're doing. So what that looks like for me as a health educator is supporting those trainings. I also help to facilitate a power hour. So we did a staff capacity assessment. And from that staff capacity assessment, some results bubbled up that staff would like to have some safe spaces to discuss racial equity, intersectionality, the levels of racism. So I facilitate a power hour quarterly that staff can come and join virtually as well as in person. We want to make sure it's a safe and inclusive space. And also recognizing that public health staff have different schedules and things like that. So and so I'm happy to answer more questions as we go, but go ahead and go to the next slide. It was really hard for me to pick an area of responsibility, but I'm going to go ahead and go with the ethics and professionalism responsibility. I'm constantly thinking about co-creation, who's not at the table, who needs to be at the table, what community partners do we need to be engaging with to make sure that we're including everyone and making sure that we're operationalizing that belonging. And ultimately, that's going to lead to helping eliminate our health disparities that we see today, right? And so I'm going to go ahead and pause and I'll pass it on to, is it Michelle? Monica, Janie. Thank you.
Yep, Janelle, thanks.
Janelle, excuse me.
Thank you so much. Hey, everyone, and happy Friday. Thank you for joining us on this lovely Friday afternoon. My name is Janelle Bryan. I'm Director of Community Wellness, Outreach, and Strategic Partnership at Drexel's 11th Street Family Services. So the Drexel's 11th Street Family Services is a federally qualified health center located in North Philadelphia, run by Drexel University. At our core, we are a health center, and our staff integrates primary care, behavioral health, and healthy living programs such as yoga and art therapy to help develop comprehensive treatments plans for our patients, specifically in North Philadelphia, but we are open to folks all across the Philadelphia area. So, what do I do? A day in the life, right? If you ask a lot of people what my job is that I talk, which is not wrong. But what I really do is I bring 11th Street out of the building into our neighborhood. So one of the big things I recognize is the mistrust in the medical system with a lot of folks in the US, especially people of color. So they're not as willing to engage with the healthcare system as we would like as health providers. So I bring the essence of who we are and what we do at 11th Street out into the community, which looks a bunch of different ways. That could be tabling at a back to school night. That can be connecting a school or organization with one of our practitioners. Like, hey, like, can you go out once a month? Like the nutritionist, like, hey, can you go out once a month and do a healthy cooking class at a retirement home? So I show the neighborhood and the folks around us like what we do. And I'm hoping, that we'll build that rapport and that, community with them. So they'll come in for the full view of what we do and who we are at 11th Street. Yeah, and that works with like health equity, health education, that's definitely community health, and overall disease prevention, because I'm hoping that they won't get to the point where they have to come see us as a health center. They can just come in to use the gym or they can just come into meditation and that they stay as healthy as possible. Next slide, please. So I also had such a hard time picking just one area, right? So I couldn't pick one, so I picked three. So bear with me, right? So needs, assessment, and capacity. One thing I do is I go out and I ask the community what they would like to see. I personally don't like spinning my wheels, so I'm not going to do something just because I think it's important. I ask community members, how can we show up for you and how can we help you? And then I work from there. And then I implement it, right? With help from my coworkers and the community members themselves, and also leadership and management. So even though I work in a health center, we are run by Drexel University, and Drexel is a teaching university, which means they put their students into jobs before they even graduate through internships and externships. So at any given time, I have between 1 to like 8 interns throughout the year. And that could be pre-med students to dental students to high school students that just want to see if medicine is for them. So just helping them learn about public health is really important because I feel like we don't get our due as opposed to other parts of the medical system, and teaching them about public health and what that can look like and just giving them a little window into what their future could be if they choose to do this career path. Thank you.
Hello, my name is Dr. Monica Webb, and I am the Director of Gatorwell Health Promotion Services at the University of Florida. Being at a large institution of higher education certainly has its advantages, And due to the scope of operations within our department, we cover just about all the areas of responsibility, which is really exciting. My day-to-day varies widely. We generally operate from 8 a.m. to 5 p.m., sometimes with evening and weekend activities, because we really focus in on our target audience of UF students. And so because of that, we really try to be where students are at. So in this initial slide, you'll see a couple of different things, images from some of our outreach, individual services, our individual student well-being model that's focused on holistic well-being and the importance of balance across all the different dimensions, and an example of one of our health communication campaign. And that is because, next slide, please. If you really look at the work that we do, we focus in on the socio-ecological model. And so at an institution of higher ed that is quite large, it tends to be set up like its own community. And that gives us a lot of advantages in serving students. So we do everything from individual services all the way up through public policy and advocacy. And so my day-to-day varies depending upon what are the issues, where is the problem solving, where are the relationships that need to be developed, and how can I best advocate for UF student well-being. Next slide, please. And so because of that, we truly do target all the areas of responsibility. I also had a really hard time highlighting a top one because my day varies, and a big focus of the work that we do is making sure that we align all outreach, all services, all student engagement with their needs. So looking at collecting data to best understand our target population of UF students. And we do that through a few different ways, through the National College Health Assessment, through focus groups, through collaborative conversations. And we collect all of that information to assess, where are the gaps on campus? Where are the needs for our students? We may advocate for using the Healthy Campus Inventory that was developed by the American College Health Association. That is a great tool for working collaboratively across campus with different stakeholders in order to identify the needs of our campus community and be able to find the specific paths forward. And so day to day, it really will vary on what is going on, but we do a lot of planning and implementing, then closing that loop and looking at the assessment of the activities, the events, looking at the trend data, and then advocating back to our population in general. So for example, a few years ago, conversations and data focused in on student sleep behaviors at our institution, and we discovered the Division of Sorority and Fraternity Affairs really has a lot of requirements for students in terms of documentation and things that they need to accomplish, and they were all due at midnight. And so through those conversations and examples of data points, we were able to advocate changing those deadlines to 9 p.m. so that it would best support students' sleep needs. Along with those sort of conversations are also the population level health communication campaigns. So we really focus in on developing messaging that is very clear, focused on cues to action that will really target UF students. And we involve students in every step of the way, from planning to designing the images and the messages to message testing them. A lot of times we will create a message and think we have such a great idea. We go to test it with the students and they tell us it is cringy or it is not addressing the ultimate behavior change that we were hoping for. So we go back to the drawing board, make edits as needed, and then go back to the students again and ask them for their feedback once more. And so those sorts of conversations and opportunities really involve our target population. And that's a great way that we're able to build that trust with the students on our campus. And that also leads into leadership and management in terms of the work that I do of supporting all of the health promotion specialists that work at Gatorwell. We very much try to align passions with interests. And so I have a lot of passion in coaching up our new professionals and in supporting them. We also employ a lot of students, and it is one of my greatest professional joys to see students spend time at Gatorwell working on their professional skills, graduating, and then immediately getting positions working as health educators. So really a lot of the work that we do is across all the areas of responsibility, and it has been a wonderful professional joy to work in this area.
All right, these presentations were very wonderful. Thank you so much to all of our panelists for sharing your day in the life career experiences and your area of responsibility alignment. It sounds like you're all doing a lot. We will now transition to the roundtable portion of the webinar and give our audience a chance to ask questions of the panelists. So we already have quite a few questions coming in, but if you have a question and you haven't typed it into the question and answer box yet, please feel free to do so. Again, you can ask questions for just one panelist. If you do that, please include their name, or you can ask questions to the whole group. So let's see what we have so far. Okay, so the first question is from Karas Borsavino. How did you find your role and what experience brought you there?
So my role, the way that I got started is really interesting. I worked in emergency medicine as an EMT. That's how I broke into healthcare, what seems like a really long time ago. And that's where I sort of developed my interest for healthcare. I was fortunate enough to get a job as what's called an orthopedic casting tech within Montefiore back in 2011. It was an entry level position for sure, right? We did a lot of the casting and splinting and vital signs for patients in the orthopedic practice. But I always had this desire for more. I always identified the interactions between the patients and the clinicians. There was just a gap there, right? And what the clinicians were saying to the patients, they weren't speaking the same language. And I always tried to simplify things for patients and make it easier for them to understand. And I thought, how can I sort of spin this into a career? What am I missing here? And that's why I went back to school to get my degree in health education and health promotion. And then within the hospital, I worked my way up. And I think I forgot if it was Monica or Janelle who was saying it, or Vanessa, but our program is a fledgling program for all intents and purposes. The health education program within Montefiore is relatively new. The pre-op education program is, it just started about 4 or 5 years ago. And I really worked my way up to be where I am now by starting at the bottom and identifying a gap within healthcare. And that's how I got to where I am today.
So thanks so much, Savino. The next question is from Michael to all presenters. Can you tell us what methods you use to get financial buy-in from sponsors, employers, and communities? Does anybody want to take that question first?
I'll go.
Thanks, Janelle.
Yeah. What I'm thinking I'm hearing is, I guess, like buy-in from our employers about our jobs. So for my job, I work for Drexel University, which is a big university. So I speak to their bottom line, right? Like I said, I don't like spinning my wheels, but the way I say it to my employers is like, we can try a lot of different initiatives and a lot of different outreach, or we can talk to the community directly, get their feedback. So when we do the outreach and the initiatives, we know this is something that they want, and we're not wasting money just throwing things at an issue or throwing things at a problem. Also, when I talk about outreach, I'm just like, you want more patients, and patients want healthcare. So that could mean that it takes me to leave the building to go get them. We can't expect people just to wander in and, come to us. We should be coming to them. And even though that's a little bit more work and it means hiring someone like me, at the end of the day, it means more patients, or patients who are more likely to stay with, the health center, because they feel heard and catered to, and they feel like they're part of the solution. So I kind of bring money into it. It's about people, but I know money is what they want to hear. So that's how I frame it.
Perfect. Does anybody else want to add to that? Vanessa, would you like to add?
Sure. All organizations have a vision, mission, values. What's their vision? What's their mission? What are they trying to accomplish and leverage that and build a relationship off that. A lot of the times we're all part of the community, right? So just consider that. We're all part of the neighborhood too. So yeah.
Awesome. These are great answers. So the next question is also for all panelists. How do you balance work and personal life when working in leadership roles?
I'd be happy to start with that one. That's a wonderful question and one we are constantly looking at and evaluating. For our specific area and the work we do, we very much share the workload with our student staff. So that provides them an opportunity to see how this work actually occurs. We know very much that what we learn in the classroom does not actually occur in practice. And so finding that happy medium, learning with the challenges, it's important skills for students, that experiential learning piece. And so to support that work-life balance, we employ students that can do that outreach in the evening and on weekends to help out our load. We also work very collaboratively as a team, and we try to acknowledge whenever each of us on the team have a very stressful day or a very stressful week. And so we'll chat with each other and offer to take on certain pieces of that stress. So having that collaborative environment is really beneficial. Preventing burnout is a constant conversation, especially since the pandemic and the pressures we all experienced during that pandemic. So it's been wonderful since then to acknowledge that this is something we all live with, and how do we practice what we preach when we're talking to students regarding work-life balance and truly employ that within our own day-to-day operations.
Thanks, Monica. Does anybody else want to share perspective? One more person, maybe?
I think that one of the most important characteristics of somebody in a leadership role is making sure that you have time management as an utmost priority. As you heard mentioned earlier, we have two daughters. I have a wonderful wife. I commute to work. There's a lot of stressors, right? They play sports. I play sports. Life is busy. I think it's really important to ensure that you're very good with time management so that you can block out sections of your life to take care of separate tasks. And you need to set boundaries with patients, with superiors, with everyone around you. You need to set boundaries to ensure that you can maintain that work-life balance. When it's time to work, you work. When it's time for family, it's family. It's really important.
Thank you. And Vanessa, I saw that you unmuted. Did you want to add something?
Sure. Actually, one of my last piece of advice, it's kind of early, but is self-care. My advice is going to be self-care for everybody. As Monica said, I was part of contact tracing during the pandemic, and it really contributed to a lot of burnout, right? So, as Savino said, putting up those boundaries, but also checking in with your coworkers, right? We all have lives outside of work. Asking, how Savino, how are your daughters? How are they doing? How was the birthday party? Really checking in, going beyond the hi, how are you? Really makes a difference. It humanizes us. We learn so much more about each other. We learn about each other, and it contributes to that self-care. Rest is not a reward, so just remember that. It's also a requirement.
Excellent. The next question is from Deborah. She wants to know if there are any presenters or panelists working on youth apprenticeships in health science or community health.
I'll go. So I'm not personally working on it myself, but I'm helping others who are. So in Philadelphia, there is a high school called Youth Build. It's a school for folks who can't go back to Philadelphia public schools between the ages of 18 to 21. So part of the program is getting their high school diploma, but also following like a career track. So the health career track, I take one intern per semester, and they come and they are intern with me part-time for the entire semester. And it's just showing them that there's different sides to the medical field as opposed to like, they hear a lot about like CNAs or home health aides, which is great, but there's also community health workers, folks working in public health, health education. So the internship is important because for them, this is the first time working in like, this is like a first like real job experience, like an office setting. So they're very excited about that. But also it's more about just broadening their mind to the possibilities of jobs after they graduate.
Awesome. Anybody else doing anything in this area that you want to share? Okay. The next question is for panelists with children specifically. How did your career and or career goals change when starting a family?
I can go ahead and take that one. I am the proud parent of an 11-year-old boy and a 2-year-old boy. Very wide difference between the two. And it's been interesting how my life has worked out in that way. But I think it has provided me even more passion for the work that I do. Being able to see some of the challenges that they face, that their generations are facing, has led me to be more innovative in the work. Things like adopting AI, trying to use AI almost daily in my work because knowing their generations will be using it daily as well. Being able to understand how to develop online relationships and what that looks like and the importance of having online friends because loneliness is one of the greatest impediments to our students' success. So being able to help and coach students on the skills that I'm seeing even with my own children. So that provides a lot of passion. And then, going back to the conversations on setting healthy boundaries, I want to make sure that I'm always at home to give the kids their dinner, their baths, and put them to bed. But that's that critical point for me and where I draw the line in terms of boundaries. But other than that, my schedule is very flexible and I'm happy to go meet with students after, an evening hours if that's what works best with their own schedules. So really having that flexibility I found has been beneficial as well because students value that support around their own schedules and my own children get to see what it's like working in a fluid environment.
Thanks, Monica. Anyone else want to add to this question before we move on? Okay. So the next question is from Chad for all presenters. This one says, do you feel that organizations like the National Wellness Institute or WellCOA, et cetera, if you're familiar with those, are diminishing the value of health education and the health education professionals in the workforce? This person, Chad, says, I'm noticing more wellness-related certificates being awarded and individuals being employed in health promotion or health education types of roles without having a health promotion or health education or public health degree, and then no certification or association with organizations like NCHEC that are the gold standard. It's kind of a long question, but anybody who wants to maybe provide their thoughts?
I'd be happy to start on this one. I think an important thing to remember is no one profession owns wellness, and there is more than enough opportunity for well-being services and support to go around. And so I find those situations to be an opportunity of discussion on, what are the specific things that individual is doing or the specific scope of operations. Is this an opportunity for them to learn more about NCHEC and about credentialing? How are the services you're offering different from their services? So for example, on our campus, we have a counseling and wellness center, we have a student healthcare center, we have case managers. There's lots of folks doing this work on campus. What sets Gatorwell apart from these other areas is we provide targeted student behavior change. So really focusing in on their impediments to academic success, focusing in on the importance of balance with their well-being. We are not providing counseling services, but we are providing behavior change support. So having those conversations, having them frequently, and providing the opportunities for growth for individuals, I think it can actually be a positive thing.
Monica, I think you hit the nail right on the head. Excellent response. And you know, one of my points of advice for the audience this afternoon is to just advocate for that CHES credential. I mean, it's such an amazing credential. It's such an important credential to have to sort of further your career, because though there are all of these wellness certifications out there, I think that the CHES credentials and the certification aligns with so many different aspects of providing important health education and good health care. So go out there and if you do get your CHES credentials, advocate for it.
Awesome. Thank you both. The next question is from Marty, and this one isn't addressed to anyone, so I think anybody could answer. Marty's asking, is a director of patient education a position within most healthcare systems? If not, should this be a standard? And then just if you can say why or why not.
I'll field that one since it's my position. I don't know. It's a great question. You know, I give a lot of credit to Montefiore Medical Center and specifically orthopedics for understanding how important health education is to good patient outcomes. And they put this position in place. I was lucky enough to get it. But I think it's really important. You know, we've seen some great programs come out of our health education team. You know, we recently had shoulder surgeons coming to us and they were saying, we have, after shoulder surgery, you have to wear a sling for 6 weeks, right? While the shoulder heals, right? So we had them come to us and they're saying, our patients aren't wearing their sling, or our patients are moving their arms too soon. Come figure out what's going on here. And we observed, we watched, we saw what was going on. And they were using language the patients didn't understand. So we implemented something called the If You Can See Your Hands initiative, right? We told patients, if you can see your hands in the sling, you're doing the right thing. But if you can't, right? If you can't, this is bad. Every time you can see your sling, it's thumbs up. If you cannot, I'm sorry, if you can see your hands, just thumbs up. If you can't, you're going to injure your shoulder. And slowly but surely, patients came back and they were saying, I can see my hands. I can see my hands. I can see my hands. And they started to do well. Why? Because we identified what the clinicians were telling them was all medical jargon that they really couldn't understand. So we simplified it, spoke a different language patients could understand, and we made it post-operative outcomes better just from a simple initiative. And that's why I just think that this patient education thing is really, really important.
Katie, I'm going to just chime in for a quick second. I know I'm not one of the panelists, but having worked with interns, undergraduate interns in health education for a very long time, this is my 19th year doing that. I've seen some of our students who have a passion for the healthcare industry go into their internship setting, very clinical setting, similar to what Savino's speaking about, and prove their worth to folks that didn't even know they needed a health educator to accompany them. And so I think there's some opportunity for our students as you move into either volunteering or, you know, internship opportunities, practicums, to try to really set the record straight of how valuable you are and the time that you save the employer, right? Because it does usually come down to bottom line, but more importantly, the work that you're doing is so valuable to the patients and their families, and they start to, you know, basically compliment you. And it's so nice to have this person who can speak with us and directly meet with us for as long as we might need, right? I think there are opportunities, even as a student, to try to find your niche and show your worth.
Well, thank you both. Yeah, Holly, I have had similar experiences with the interns at my university as well. So I think that's some really great advice for students out there. Okay, next question is from Felicia. I'm really interested in the panelists' answers to this question. Do you have any public health or health education podcasts or books you'd recommend?
I actually have a couple on my desk right now. The Pandemic Century by Mark, and I can't pronounce their name. I'll put it in the chat later. It's a picture of the book right here. Both of these books are about the pandemic, but it provides great perspective on the different approaches. And I found myself being able to identify with certain approaches based off of my skill sets with my certification. The other really good one by a very famous author, Michael Lewis, who has written many books that have also been turned into movies, The Premonition. It is also focused on the pandemic. Sorry, you guys can't see that. But great books. And again, I always find it important as a professional to reflect. And now we are coming on close to 5 years since the pandemic hit. So it's a great time to reflect back on those years of the pandemic and what we've learned as professionals. And I have found that those books do a great job of kind of showing that holistic picture and approach when it comes to pandemics. And I think it's really important for us as professionals to learn from our history and prepare for the future.
I have two. One of them is called The Power of Habit. Okay, it's a great book. It's called Power of Habit, Why We Do What We Do in Life and Business. And it talks about culture change, behavior change, and it really sheds light on why people do what they do and ways to change it. And it uses a lot of great case studies that will really be eye-opening for you once you read it. The other book is called Tribe, Tribe, by a war reporter named Sebastian Junger. And in it, he basically explores the power of community and outcomes, not only health outcomes, but why communities who are, a lot of them are impoverished, and why they become so tight-knit to make sure that everybody is okay within them. And the reason that I like this book is because he actually goes into a community in New York City, close to where I work, and did a lot of research out of that community. So it's a great book if you want to read it. It's called Tribe by Sebastian Junger. Those are my two recommendations.
Great recommendations. Thank you. The next question is from Valerie. Do any of you, especially those who work for universities or state federal organizations, have any experiences or trouble with DEI program elimination?
I'd be happy to start us off on that one. Obviously, we are in the state of Florida that has been very well known for some of those changes over the last year and a half. I wholeheartedly rely on my professional preparation, competencies, and responsibilities. So it has been wonderfully beneficial to rely on NCHEC and be able to demonstrate to folks when those conversations come up of why do you target certain audiences. We use a lot of data-driven decision-making. So we're able to pull from the data and demonstrate, these are certain groups of students that need further support to access our services, for example. But leaning back on our professional competencies is critically important to be able to say, we are expected as professionals who are credentialed to do these things. And part of that is also leading bravely and being able to identify if certain terms aren't supposed to be used. How do you communicate this information in a way that will still be beneficial to the students that you serve? And again, my professional preparation has been where I have leaned heavily on those challenges.
Great, thank you. The next question is from Lily. How do you keep your programs and messages consistent with the current research and clinical practice? Do you collaborate with others? And if so, how?
For us, every Thursday we have a meeting with our Joint Replacement Center. So that includes over 50 surgeons and several more different ancillary practitioners within this meeting. All of the current research is reviewed. Any protocols are changed. There's United States wide, people in healthcare may know about this, but because of the recent hurricanes, there was a big factory down south that was impacted by it, and they made a lot of this saline for the IVs, right? So we had to change how we're doing things at the hospital to make sure that we had enough saline for the patients that are going into surgery and that are admitted. So we're constantly having weekly meetings on all of the updates regarding healthcare within the community, within the nation, and current literature. So yeah, and we adapt all of our programs based on different recommendations, evidence-based recommendations for sure.
Great, thank you. I think we have time for maybe one more question. So Bria asks, care coordination, collaboration, and stakeholder engagement in healthcare is important. When working with clinicians and in government settings or just in your job, how do you show the value of having a health education specialist or a health educator at the table?
For us, it's demonstrating how we impact students' lifelong well-being. So really demonstrating the health outcomes, the student learning objectives, being able to use that data, being able to collect not just quantitative data, but qualitative data, where students describe the experiences they've had when they've come through our office for services. I think it continues to be conversations as to, again, how is our area different from other ones? Because, you know, you don't want to have a duplication of services, but once you start talking about that behavior change and supporting students' lifelong well-being and all the different examples of what that means, that's where we're able to find commonality with other areas, and other areas are able to see where we are the experts in certain things.
I just wanted to echo something what Vanessa said pretty much is like your mission, the mission and vision statement for the organization that you're working with. Like remind them like, hey, this was important enough for y'all to put on your website to tell people like this is the goal. So like let me help you reach this goal that you have thought out and that you're actively working towards every day.
And I think it also, we bring a different set of skills to the table, right? Cultural, linguistic, appropriate skills. A lot of health educators, like I said, they're from community, they have lived experience. And so leveraging that lived experience to engage with community members is so crucial to getting the work done. So.
Wonderful. Thank you all so much. These were really thoughtful questions. I know we didn't get to all of them. I'm sorry that we didn't have time, but we appreciate the panelists sharing their contact information. If you want to reach out to any of them directly, I think they would welcome that. If we could go to the next slide. We are nearing the end of the webinar, but we've asked the panelists to leave you with a bit of advice today. They were asked about the skill they consider most important for success as a health education specialist. So I'd like to give them a chance to share, and we'll go in order of the photos here. So we'll start with you, Janelle.
Sure. I had a quote, I think 2 weeks ago, and the person said, the people closest to the pain should be closest to the power. And that really sat with me. And it just made me think about cultural humility. Like that's a big thing in health education, like recognizing whether you're a director or entry level, you are in a position of power over the people that you are helping. But that doesn't mean that you're the expert. And recognizing like it's okay to ask questions. You should be asking questions, right? Because you don't know everything. But also including the community, whatever that looks like for you, whether it's college students or whoever, including them in the decision-making process will only help your work, right? So pulling them in as much as possible. Don't give them extra work. We'll be like, hey, if you want to help out in any way, I will take it. Help me help you. Teach me information to make your life better. So cultural humility is something I think about a lot.
Excellent advice. Thanks, Janelle. Savina, what about you?
I think the most important aspect of health education is always understanding your audience and being able to communicate in a language that they can understand. And I don't mean a spoken language. I just mean to make sure that you're speaking at a level that makes sense to them. Whether you're working with patients, colleagues, or external partners, just make sure that they understand all of the information that you're giving them. And a great way to make sure that they do is using the teach back method, and just ask them, can you explain in your words, what we're going to do during surgery? Make sure that you're always talking their language and adapting to make sure that they understand.
Thanks, Davina. I think that certainly translates to any workplace setting. Great advice. Monica, how about you?
So I would recommend that folks be open to growth and new experiences, because sometimes failure can really be the greatest opportunity for growth. And failure can be very painful. However, it's an opportunity to grow. It's an opportunity to see, different experiences, perspectives, opportunities. So really learning in the moment is a key. And that oftentimes helps in things such as relationship building and having collaborative conversations with other folks. Acknowledging in the areas that you have failed has often supported others. So, when you get up and you're presenting to almost 400 participants in a webinar, acknowledging that, I'm nervous and that is part of my growth, and being nervous of presenting to so many people, that helps set the stage and build that relationship with others.
Yeah, that's a really hard one, but a really, really important one. Thanks, Monica. And last but not least, Vanessa.
Thank you so much, and thank you to all my fellow panelists. I literally wrote down cultural humility. Self-care was the one I mentioned earlier. Opportunity is everywhere. Always remember to fail forward. Like Monica said, it's okay to fail. Continuing to learn, practicing that cultural humility, not just towards others who may not look like you, but also those coming up behind you, right? Remember to share your experiences and knowledge as those are coming up behind you, and also take advantage of those veterans around you that have 20 years of health education experience. Yeah, I'll stop there. Thank you.
Awesome. Thank you all so much. These were really excellent pieces of advice to leave our audience with today. And you all did such a fabulous job sharing your experiences, responding to questions. I learned a lot today, so thank you so much. As we finish up today, we'd like to encourage you to complete the Health Education Practice Analysis 3 or HESPA 3 survey to share your voice and help shape the future of health education. The survey is open until November 15th and should take you about 90 minutes to complete. By taking the survey, you'll be able to contribute to the health education profession, and completed surveys will make you eligible for multiple prize drawings, including $500 Visa gift cards. Additionally, CHES and MCHES will earn 2 Category 1 continuing education contact hours. Next slide, please. And with that, we've reached the end of the webinar. Again, thank you to our panelists and for everyone for joining us today. Please follow and join the growing online community of certified health education specialists, students, and other health professionals on NCHEC's various social media platforms. On those platforms, you'll find news, interviews and features, exam information, continuing education opportunities, networking opportunities, and a lot more. Happy National Health Education Week, everyone. Have a great Friday.
Thank you.
Thank you.